All right, now we have reached cardiac tumors. Let's start off with a myxoma. Look at this MRI. So when you're shown an image on your exam, don't freak out. Take a second to orient yourself. Obviously we have labels here, but we can sit here and look at this image and say, okay, this is a cardiac MRI, and there's something very, very large and weird here in the left atrium. And we know it's the left atrium because it's the most posterior chamber. This is the anterior side. This is the posterior side. So what could potentially be in the left atrium that is a huge mass like this? Considering the slide says cardiac tumors, that's exactly what it is. But that won't be the question. You need to know the most common reason for tumors in the heart is metastasis. And it's usually due to melanoma or lymphoma. And that is super high yield. This is an incredibly high yield fact because it's an exception, and test question writers love exceptions. Now, the most common primary cardiac tumor is going to be myxoma, and this is in adults. And in kids, we're going to be talking about rhabdomyomas, which we'll talk about in the coming slide. Now, what do you need to know about these myxomas? Well, these myxomas are usually benign tumors, and they originate from mesenchymal cells that make our heart valves. Perfect. That makes a lot of sense, right? Considering the name myxo means mucus, and our heart valves are covered with mucopolysaccharides. Mucopolysaccharides are made by cells that are mesenchymal cells derived. Okay, now, the most common place for these mesenchymal cells to start proliferating like crazy is near the fossa ovalis. Remember, that's a remnant of our what? Foramen ovale. These are big round masses that sit on a stalk, like this. They kind of look like wrecking balls. So let's do a quick vignette. Miley Cyrus comes in. She just passed out in the middle of her concert. Vital signs are stable. She's in no acute distress. Labs are normal, including a negative urine drug screen, which is surprising. The only abnormality on physical exam is that you hear a murmur that kind of sounds like mitral stenosis, but her medical records indicate no history of any heart problems when she was seen last a year ago. So what's she suffering from? She's suffering from a myxoma in her left atrium. Now the problem is that if we have our left atrium here and our left ventricle here separated by the mitral valve, this huge wrecking ball myxoma is going to crash into the mitral valve and prevent appropriate blood flow from the left atrium into the left ventricle. And this is why Miley Cyrus has been passing out. She has a myxoma that is impeding the filling of her left ventricle, which now means that there's going to be a decrease in cardiac output. Decrease in cardiac output to the brain makes you pass out. Now sometimes when this thing crashes, it makes a sound called a tumor plop. Now that'll be described on cardiac auscultation. That's a very rare sound. Do not be expected to have to listen to that. So what about the tumor most often seen in kids that we said was a rhabdomyoma? Rhabdomyomas are associated with a very super high yield disease, which is tuberous sclerosis. Now what can you tell me about tuberous sclerosis? It is due to a genetic mutation in the proteins hamartin and tuberin. So both of these proteins regulate normal central nervous system, cardiac, eye, hepatic, renal, and skin development. When these proteins are mutated, you expect there to be excessive cell replication in these tissues, and this leads to the potential for tumor development. Tuberous sclerosis is a disease in which there are tumors in all of these tissue types. So the one that we really need to remember for the cardiology section are the cardiac manifestations, which are rhabdomyomas. Here we can see an image of a rather large cardiac rhabdomyoma. It's huge. So what happens is that the protein tuberin is responsible for telling cardiomyocytes to stop growing. If tuberin's malfunctioning, guess what's going to happen? We're going to have a huge cardiac tumor just like the one that's on our screen. What about this thing called Kussmaul sign? Remember when we were talking about tamponade, we mentioned that the increase in the intrapericardial pressure from an epicardial space effusion or hematoma impaired diastolic filling of the right side of the heart. So a guy named Kussmaul noted this and also saw how impaired diastolic filling causes venous blood to back up into the right atrium, to the superior vena cava, and then all the way into the internal and to the external jugular veins. So here on this image, we can see what it is, what Kussmaul saw. Now we move on to vascular tumors. So angio indicates that we're dealing with a vessel, and sarcoma indicates that we're dealing with the malignant type of tumor that's derived from mesenchymal tissue. So these are malignant endothelial cell neoplasms. So look at the image here. Instead of being lined with normal endothelial cells, these spaces that should be vessel lumens are lined with these very blue malignant looking cells. They're all stacked together and they're very basophilic or blue because they have very prominent nucleoli because they're replicating so much, just like tumors do. Angiosarcomas typically occur in sun-exposed areas, so you would expect the head and the neck to be one of the top two places to be looking for these. Two other high-yield associations are in the post-mastectomy patient with chronic lymphedema and the patients that receive radiation therapy. So let's talk about this. A radical mastectomy includes the removal of all breast tissue plus lymph nodes plus lymphatic vessels. Without these lymphatic components, we do not have proper lymphatic drainage of tissues in the arm. So remember that some intravascular fluid will move into the interstitial space, out of the vessel, and this has to be drained by the lymphatic system, and then it goes back into the lymph nodes. So when you disrupt this by removing it, now we're going to get congestion within the vasculature. We're going to have an increase in hydrostatic pressure within the vessels. Now the endothelial cells that line these vessels are not going to like this at all. They're going to be subjected to chronic stress, and they're going to undergo damage from the increase in hydrostatic pressure. Over time, this will increase the risk that some of these endothelial cells make mistakes when they're replicating their DNA, because they're repairing themselves. Mistakes in DNA repair eventually lead to the development of malignant endothelial cell neoplasms, aka angiosarcoma. Now what about the hepatic angiosarcoma? That is extremely high yield, and this is classically associated with exposure to arsenic or vinyl chloride. So arsenic is really bad because it binds to sulfhydryl groups that are found in very important DNA repair proteins. So basically, it's going to cause DNA damage. Even worse, it's metabolized into the liver into even more carcinogenic compounds. So in the liver is where it has its greatest risk for causing damage, and this is why it can lead to hepatic angiosarcomas. And vinyl chloride is another one that's extremely high yield. It is a compound used in the production of PVC pipes, and it's broken down by CYP450 in the liver into metabolites that are very strong alkylating agents. Yeah, and that's bad. Why? Because alkylating agents form crosslinks in our DNA, as we can see here in this image. These little diamonds represent alkylating agents such as the breakdown products of vinyl chloride. Alkylating agents form very strong bonds with the bases that compose our DNA. With these very strong bonds, DNA helicase cannot come in here and unzip the DNA molecule. And that's another example of how this can lead to angiosarcoma. Now, what's another example of an agent that we use to alkylate DNA, like rapidly replicating B and T cells to fight autoimmune disorders? We do this on purpose with drugs like cyclophosphamide. Now we reach bacillary angiomatosis. These are benign capillary skin papules caused by the gram-negative bacilli, Bartonella enzalae. And that's how they were named. So this is due to a gram-negative bacilli producing lots of angiomatous masses. Remember, angio means blood, oma means mass, and osis means that there's a lot of whatever it is that we're talking about. And that's exactly what we see in this image. It looks like a bunch of little vascular masses on the skin of our patient. What is important to know is that this is seen in AIDS patients. So it's often going to try to confuse you with Kaposi sarcoma, but it is not Kaposi's. How are you going to be able to differentiate? We're not dermatologists. Well, they have to give you a clue by giving you some risk factor or exposure. So here's a hint to diagnose this. Cat scratch fever. A cat scratched this AIDS patient and inoculated them with Bartonella enzalae, and that led to the formation of these angiomas. Now we move on to cherry hemangioma. This is very simple and quick. Just look at the image here. These are benign capillary hemangiomas that occur in the elderly. They look like cherries. They never regress, and they increase in frequency as the person ages. Now we have a flash quiz. Let's see if we were paying attention. Which cardiac tumor presents with syncopal episodes? The answer is a myxoma. Syncope can occur with the ball valve obstruction of the mitral valve. Let's see that here in this image. You can see here's the myxoma growing on the peduncular stalk and extending into the left atrium. When the mitral valve opens, this will crash and impede the opening to the left ventricle. This decreases the end diastolic volume of the left ventricle, and that leads to a decrease in stroke volume. This decrease in cardiac output will lead to syncopal episodes in patients that do not have appropriate cardiac output because their myxoma is crashing into that mitral valve. Now we talk about something that's extremely high yield, cystic hygromas. Do you see anything abnormal in this image? How about this? You can also see that here in this poor little guy. He has a cystic hygroma. So hygroma means moist. So the docs that first described these noticed that there was a bunch of fluid or moist cyst-like structures in the neck. We recently figured out that this is due to a malformation of the neck's lymphatic system. A malformation of the lymphatic system means that we cannot drain fluid appropriately. So what's it going to do? It's going to accumulate in the jugular lymphatic system. The classic, absolutely must never forget association of a cystic hygroma is with Turner syndrome. Never forget that. Another vascular tumor is a glomus tumor. These are very, very painful. Benign growths derived from the modified smooth cells that are part of the thermoregulatory structure of a glomus body. Therefore, they're called glomus tumors. Now, what's a glomus body? Basically, a glomus body is an AV shunt surrounded by connective tissue that helps shunt blood away from the skin when we're cold. And this should make sense that glomus tumors occur in places where our glomus body should be regulating excessive heat loss, such as in the fingers, the wrist, the forearm, and the foot. These are very painful because glomus bodies are heavily innervated because the nervous system needs to be able to get a lot of neural feedback to appropriately control thermoregulation. Here we can see what we're talking about. This image here shows a subungual or underneath the nail germinal matrix where glomus bodies are. Here's where the tumor is being removed, and you can see it here prior to the section. This is normal here. Now we go on to an extremely high yield one, Kaposi sarcoma. So this Hungarian dude named Kaposi originally found this tumor back in the 1800s in Eastern European patients, particularly really old dudes. And the type that we need to be concerned about is the Kaposi sarcoma that occurs in association with transplant patients or AIDS patients. Basically, immunocompromised people can have Kaposi sarcoma. So little did Kaposi know it was actually due to a virus called HHV8. And when you're immunocompromised, there's nothing to stop HHV8 from proliferating like crazy inside of endothelial cells. So how does HHV8 infecting endothelial cells lead to this malignancy? Well, what happens is that HHV8 tells the cell to produce a protein that will directly bind p53. And this allows the cell to now start producing cyclins to bypass the inhibitory role of retinoblastoma. So basically, we knock out p53 and we circumvent retinoblastoma, and now we have unregulated cell proliferation and signaling. What other virus produces proteins that target these two? Remember, HPV produces E6 that targets p53, and then E7 that targets retinoblastoma. So this is a very interesting virus because it has a similar mechanism of action to another one that you have to know. Now, HHV8 has this certain mechanism that allows it to take over endothelial cells, and it tells the cells to start pumping out a bunch of vascular endothelial growth factor. This is why these tumors are so vascular. They start making a bunch of vascular tissue. Now, where are we going to see these lesions? Number one place you always need to look is in the mouth. As doctors, we're not comfortable in the mouth, so be prepared to see something like this. You can also see them in the GI tract, or we can also see them on places that are very high yield, such as the skin, right? Also be careful about patients that might have these in the respiratory tract. We have a very broad distribution where we can find these tumors. Now, why does this often get mistaken for bacillary angiomatosis? Both of these are infectious processes that result in endothelial cell proliferation and improperly formed vascular tumors. How are you going to tell them apart? The type of immune cell, they're going to give you that. In Kaposi, we know it's a virus, right? HHV8. So there's going to be mainly a lymphocytic infiltrate. But in bacillary angiomatosis, we know it's due to what? It's due to Bartonella enzalae. This is a gram-negative bacteria. We don't need T cells to get rid of bacteria. There's going to be a very strong neutrophilic infiltrate. A pyogenic granuloma is a type of capillary hemangioma that is stimulated by angiogenic factors. Angiogenic being increasing the growth of blood vessels. And this is usually due to an excessive response to trauma, and it can also be seen in pregnancy. You expect angiogenesis in both the situations because in trauma, you need to repair capillaries, and in pregnancy, you need to make capillaries because the placenta is releasing tons of vascular endothelial growth factor for the placenta to be able to provide for the fetus. So this name is kind of a misnomer because pyogenic kind of makes you think about pus, which would indicate some sort of infection from neutrophils dying, but there is no infectious process going on here. We only see pyogenic granulomas in the setting of trauma or pregnancy for your step 1 exam. It's often described as a polypoid mass. As you can see here in this image, it is very, very similar to a polyp because it's sitting here on a stalk and it's a large mass that looks like a tree. These can ulcerate and bleed. They ulcerate and bleed very easily because there's a large mass being supplied by a very thin stalk. Not enough blood flow means that these things will eventually outgrow their blood supply, in addition to having weak vessels to begin with from all of the vascular endothelial growth factor. So this continual damage leads to continual healing attempts that eventually these things will form a ton of granulation tissue, hence the name granuloma. It is important to note that there is no actual granuloma. There's only granulation tissue present on pathologic specimens. Strawberry hemangiomas. These are high yield because they can be confused with cherry hemangiomas. So hemangiomas are composed of abnormal vessels filled with blood that usually appear at birth. The most common places for them to occur are on the head and the neck, but sometimes you can have visceral involvement in organs such as the liver. So most of these guys regress spontaneously at age 5 and do not progress to be a malignant lesion. Here we can see our strawberry hemangioma. It is a type of capillary hemangioma that has an overlying, very thin epithelium, and that's why it's elevated above the skin. They're essentially just a bunch of jumbled, very tightly packed, thin capillaries put together in this orientation that makes them look like a strawberry. It is benign because it kind of looks like normal vessels. Strawberry hemangiomas will grow up until the patient is probably about 5 to 8 years of age. Number 5 is the classic buzzword here. They will regress spontaneously. Now, we have to be able to differentiate between strawberry and a cherry hemangioma. Remember, cherry hemangiomas occur in the elderly and they do not regress. They only get more frequent as we age. Okay guys, good job. Keep up the good work.